Today we'll be talking about menstrual disorders in women. Menstruation is a non-negotiable part of a woman's life, starting from adolescence to menopause. A good menstrual pattern is an indicator of woman's health. So what are the different menstrual disorders? Amenorrhea. Suppose a girl does not get her menses by the age of 16, it is called as amenorrhea. Or if she gets her menses for a few cycles and stops menstruating, it is called as secondary amenorrhea. Then menorrhagia. Menorrhagia is excessive uterine bleeding. Either the blood flow is increased or the woman bleeds for a longer period of time. Polymenorrhea. If the woman bleeds very frequently and if a cycle is less than 21 days, it is called as polymenorrhea. Metrorrhagia is when a woman has normal menstrual cycle, but after she finishes her menstrual cycle, she keeps bleeding in between her menses. The woman has to note down the last date of a menstrual period, the duration of a cycle, how many days she bleeds, and how much she bleeds. So this can be measured by noting the number of pads she uses per day. Now, what are the causes of menorrhagia? Causes of menorrhagia will also depend on the age of the woman. So puberty menorrhagia occurs because there is lack of a little coordination between the hypothalamus, pituitary and the ovary. The hypothalamus secretes certain substances which have an effect on the pituitary gland, which is located at the base of the brain. Certain hormones are again produced by the pituitary which act on the ovary, and the ovarian hormones again influence both these hypothalamus and the pituitary. So this is known as the HPO axis. Now coming to menorrhagia in the reproductive age group of women, that is between 20 years to 40 years. There can be causes which cause menorrhagia or excessive blood flow. Ovarian causes, certain ovarian tumors which produce estrogen, follicular cyst can cause menorrhagia. Diseases like pelvic inflammatory disease, endometriosis, uterine fibroids, uterine polyps can cause menorrhagia. Certain systemic diseases and endocrine imbalance like coagulation disorders, hypothyroidism can also cause excessive bleeding. If excessive bleeding occurs during the perimenopausal period or during menopause or postmenopause, malignancy or cancer has to be ruled out. So in short, menorrhagia or excessive blood flow can be a sign of an underlying disease and should not be neglected because it can cause anemia which hampers the quality of life of a woman. Treatment of puberty menorrhagia will include modifying lifestyle factors and diet, because today's teenagers, they eat a lot of fast food. So fruits and vegetables which contain natural antioxidants have to be included in their diet. Correction of anemia is another important factor. Iron preparations as well as natural herbal preparations which contain cassis also help in correcting anemia. There are certain Ayurvedic medicines, Amlaki, Vasa, Lodra and Nagkeshar, which act as antioxidant and astringent in controlling the uterine bleeding. Ashoka and Shatavari help in restoring the hormonal balance and regulating the menstrual pattern. Other treatment will depend on the cause of menorrhagia. If it is ovarian tumors are responsible, they have to be removed. If there is a uterine pathology, that can be corrected surgically or by using certain hormonal preparations. Treatment modalities may include laparoscopy, hysteroscopy to ascertain the cause of bleeding. In conclusion, excessive menstrual bleeding can be controlled by modification in diet and lifestyle factors. Safe, non-hormonal treatment is usually preferred, and specific treatment can be decided by the treating gynecologist.